In this section, I want to talk a little bit about the hepatitis viruses. So the reason these viruses are all grouped together is because they all cause a similar type of infection in the liver. However, they are not necessarily related viruses. There are at least 6 different viruses that we know of that are classified as hepatitis viruses. They are given letters A through E and G. There was a virus they thought was hepatitis F. It turned out it was something else, so F went away, but G was still there. Again, they're all classified because they target the same organ, the liver. However, they differ in structure, replication, time course of disease, genetic material, etc. So this is a table kind of comparing and contrasting the different types of hepatitis, with the exception of G, which is pretty uncommon. Most commonly, patients who have hepatitis will have either A, B, or C. And you can see, again, P. coronavirus, hepatinovirus, flavivirus, viroid. They can be transmitted in different ways, fecal oral, or sexual, or bloodborne. The onset is different, severity is different, mortality is different, whether or not it's chronic, what other diseases could be associated with it, how it can be diagnosed, etc. So you can always come back to this table and kind of get an idea of what these viruses really are. So hepatitis A is a P. coronavirus. So you might remember that those are enveloped, not enveloped, they are non-enveloped, naked, positive sense strand, single-stranded RNA viruses. They are very, very stable. And because of that, they're hard to get rid of with regular types of disinfection or treatment. This is called infectious hepatitis because it's often associated as a foodborne illness because it is transmitted through the fecal oral route. This can sometimes be associated with outbreaks at like restaurants or with other types of food items if a food preparer, like a chef or somebody who's packaging food, has the infection and doesn't wipe their hands very well. There you go. So, as you might imagine, because this is called hepatitis, it infects the liver. So it has receptors on the liver and on T cells. Unlike a lot of naked viruses, it isn't cytolytic. It's actually released by exocytosis. So one of the other, quote unquote, nice things about hepatitis A is that it generally doesn't cause a chronic infection. This is usually going to be an infection that you can clear. And because it doesn't cause chronic infection, hepatitis A is not associated with causing cancer. And when we talk about some of the other hepatitis viruses, we'll see how they actually are associated with causing cancer. This is one of the most common hepatitis viruses. It's associated with about 40% of hepatitis cases. And it can spread rapidly because people will be contagious before the symptoms occur. So they can be shedding virus in their stool and then transmitting that virus to others before they even know that they're sick. So we're generally going to diagnose hepatitis A based on symptoms and known exposure. And symptoms are often going to be, yellowing, like a jaundice. That's what this means here, icteric. So because it's causing infection in the liver, you're going to notice that. It is possible to do passive immunization during the incubation period. So if you ate at a restaurant where there's a hepatitis A outbreak, You could potentially get preformed antibodies against the virus. So that could help you prevent the development of symptoms. And of course, we do have a vaccine that's available for hepatitis A. So a lot of patients are not going to experience symptoms. Not everybody who gets hepatitis A does experience symptoms. But again, that jaundice is going to be really a clear marker of a hepatitis infection. Otherwise, some of the symptoms can be a little bit nonspecific. So it could be like nausea, abdominal pain, tiredness, fever. So it's not necessarily like, oh, I definitely have hepatitis. But once you see that yellowing, particularly in the skin and in the whites of the eyes, that's when you would know. Hepatitis E is very similar in terms of the type of disease it causes. It's not necessarily a similar virus, but it's the abrupt onset, abdominal pain, nausea, potential jaundice. However, it has a higher mortality, and we see it more if we go back to our table. Of course, we can look at that, but we see it more, especially the high mortality in pregnant women. But if we look at hepatitis A, the mortality rate is under 5%. In normal patients with hepatitis E, 1 to 2%. So again, it's not a huge mortality, but for pregnant women, definitely, and it is significantly higher than that of hepatitis A. Okay, so let's go back now. We'll talk about hepatitis B. So hepatitis B belongs to its own group. They are the hepadnaviruses. They are enveloped, and they are DNA viruses. So this is the most common form of hepatitis that we see as like serum hepatitis or bloodborne hepatitis. It can also be a sexually transmitted infection. This virus, compared to hepatitis A and hepatitis E, can cause a chronic infection, and it is associated with the development of liver cancer. One of the really unique things about hepatitis B is that it has a very different type of replication than other DNA viruses. Normally, we think of a DNA virus, it gets into the nucleus, it replicates its DNA in the nucleus, it does transcription, it does translation, and then it gets out. What these hepadnaviruses do, so what hepatitis B does, is it starts out the same. We go into the nucleus, we transcribe, we export, we translate, and then we reverse transcribe. So hepatitis B, the hepadnaviruses, are another group of viruses that contain reverse transcriptase. So there are two groups of viruses that contain reverse transcriptase. One of them we're talking about now, the other we talked about just a little bit ago. So I would definitely keep that in mind if I were you. So instead of replicating its DNA in the nucleus, it reverse transcribes the transcript it exported and uses that as a template for the DNA synthesis. So that's kind of weird, but also kind of cool, and provides potential targets for therapies. One of the other unique things that the hepatitis B virus does is it produces what are called antigenic decoys. So it sends out like proteins or pieces of an envelope that basically bog down the immune system. They trick the immune system, and the immune system will attack these decoys, allowing the virus to spread from cell to cell to cell. Unfortunately, they are also relatively stable for an enveloped virus. Remember, enveloped viruses tend to be easier to destroy, but hepatitis B is a little bit more stable than that. And as you might imagine, because I did mention that this can be a chronic infection that can cause cancer, the genome can integrate into the host cell chromosome. The hepatitis B virus can be found in a number of various bodily fluids. They are listed here, but as you might imagine. And so what happens when a patient is exposed to hepatitis B is that the virus will get into the body, and within 3 days or so, you're going to get replication of the virus inside the liver cells. And like we've talked about with a lot of different viruses, the majority of the symptoms that we see, or at least those major symptoms like the release of liver enzymes and the presence of jaundice, are actually symptoms that are caused by that really effective cell-mediated immune response that is able to target those infected liver cells. And those symptoms may not show up until a significant period of time after the initial stage of infection, because remember, it takes time to build a specific cell-mediated immune response. It can take anywhere from 7 to 10 days. So patients may experience some symptoms like nausea, abdominal pain, etc., before they experience the immunopathogenesis like jaundice or the release of the liver enzymes. In our patients with an effective cell-mediated immune response, what we're looking at is that those cells, specifically our cytotoxic T cells, are going to be really great at eliminating cells that are infected with hepatitis B virus. And that's going to lead to those symptoms of jaundice, the release of liver enzymes, but also is going to help lead to resolution of the infection. In our patients with a limited cell-mediated immune response, some of the infected cells will be cleared as long as they have some sort of cell-mediated immune response. But in these patients, what we're really going to be seeing is chronic disease and mild symptoms. So it's kind of that cost-benefit analysis, right? Hey, we don't have very many symptoms, but we can't clear the infection. Or, hey, we feel really crappy and have all these horrible symptoms, but at least we can clear the infection. So that's that trade-off with the cell-mediated immune response. What we'll see then in our patients who develop that chronic infection is very commonly cirrhosis. A little bit less commonly, you'll have the development of hepatocellular carcinoma or liver cancer. And rarely what you can see in patients who are co-infected or super-infected with something called delta agent is the development of fulminant hepatitis. And that's basically, fulminant means the acute onset of severe disease. What is delta agent? Well, we'll get to delta agent in more detail in just a little bit, but delta agent is another term for hepatitis D. So if a patient is co-infected or super-infected with hepatitis B and hepatitis D, there is the risk of that development of that fulminant hepatitis. And again, hepatitis D will come up in just a little bit as soon as we're finished talking about hepatitis B. So as I mentioned with the immunopathogenesis, the cell-mediated immunity can cause symptoms, but is also very important for resolution of the disease. And that's what we're showing here. Cell-mediated immunity causes symptoms, but also leads to a resolution. And then here we're looking at how the disease is spread: breast milk, vaginal secretions, blood, semen, saliva. So you can see sexually transmitted as a bloodborne pathogen to a neonate through sex, IV drug use, blah, blah, blah. So there are a lot of ways that patients can get this infection. And those of you who are planning to work in a healthcare setting, this is a vaccine that you'll definitely want to get. So the decreased T cell response in patients who are immune compromised, that can promote the chronic infection. And having antibodies is important because antibody can help protect against infection. Generally, children who are infected with hepatitis B will have less severe symptoms. So why do you think that is? The downside of having less severe symptoms is that they are also less able to clear the infection. And it's estimated that 90% of children or infants will become chronic carriers if they have the infection. So you can get swelling and necrosis of the liver, but the liver is one of those really nice organs that if we at least can get rid of the infection, you can have regeneration of some of those damaged areas. Now, if the damage is too severe, of course, that's not going to be able to be overcome. But if the damage is not as severe, once the infection is cleared, you can get regeneration of some of that tissue. So with fulminant, like that abrupt onset hepatitis, with chronic hepatitis, with co-infection with that hepatitis D or delta agent, we can see permanent damage to the liver, and we can see cirrhosis, like destruction of parts of the liver. It is estimated that there are about 850,000 people chronically infected with hepatitis B in the US, and over 250 million worldwide. Depending on the part of the world, it's estimated that about 15% of the worldwide population is infected during birth or childhood. So you can see that there are really high prevalences of hepatitis B in different parts of the world. And in these areas where we have this black dot, that represents areas that have a really high incidence of liver cancer. And that is probably correlated with or caused by the increased prevalence of hepatitis B. So our high-risk groups for infection include people from endemic areas, babies of mothers who have hepatitis B, IV drug users, people who engage in unsafe sexual practices. So it's sometimes I don't like the way the book phrases things. So it's not necessarily having multiple sex partners that makes people prone to a hepatitis B infection. It's unsafe sexual practices. So, do whatever you want to do, but please do it safely. Anyone who gets blood treatment, so like hemophiliacs, healthcare personnel who have contact with blood, residents and staff members of institutions for people who are developmentally disabled. And that's mostly because in a lot of these places, the residents, because they are developmentally disabled, don't necessarily engage in appropriate behaviors. Sometimes there can be, aggression and fighting or, inappropriate sexual behaviors. So that's why having developmental disabilities also does not necessarily mean somebody's going to get hepatitis. It's the behaviors that might happen because of that could lead to the infection. And then, of course, hemodialysis patients and organ recipients. The majority of patients who have hepatitis B are going to experience things like tiredness, loss of appetite, nausea, right upper quadrant pain. Your liver hurts. Some may experience fever, rash, arthritis. Some might have some itching if it's kind of near the skin, jaundice, dark urine. So with acute hepatitis B, so you just got the infection, 90% of people are going to resolve it. 1% will have the abrupt onset of a very severe disease. That's the fulminant hepatitis. And then about 9% will be positive for more than 6 months. Half of those will eventually clear the infection. Some may be asymptomatic carriers, and some may develop either chronic hepatitis that's persistent or chronic that's active and can lead to cancer. So again, 5 to 10% of patients will develop chronic hepatitis B, and about a third of those will have continued active liver destruction. And it's estimated that about 80% of primary hepatocellular carcinomas or liver cancers are attributed to chronic hepatitis B. That is usually a fatal cancer. It's one of the more common cancer mortalities. Doesn't necessarily mean it's one of the more common cancers, but it's one of the more common ones that can lead to death. Diagnosis of hepatitis B is based on symptoms and liver enzymes. Serology can describe the course of infection as you see the antibody response coming. Passive immunization within a week of exposure or to newborns is helpful. Treatment with polymerase inhibitors. Remember, it has that reverse transcriptase. So if you can inhibit the reverse transcriptase, that can be very helpful. Or nucleoside analogs. So there are some therapies available for patients who have hepatitis B. But of course, the best medicine is prevention. There is a hepatitis B vaccine. It's available as a series of 3 immunizations. So you get the initial immunization and then 2 booster shots. I can't remember the time window. I want to say you get the first shot, within a month you get the second, and within 6 months you get the third. And so just briefly, I want to tack on hepatitis D because it is only seen with hepatitis B. Not all hepatitis B infections will have hepatitis D, but all hepatitis D is seen with hepatitis B. So it's called delta agent. It is considered a subviral satellite. So it's this kind of weird piece of genetic material, and it only can replicate if it is in the presence of hepatitis B. So it can be transmitted with hepatitis B as a co-infection or after a patient has hepatitis B as a superinfection. So basically if they're exposed again. And with all of these, you're going to see cirrhosis, acute hepatitis that can become fulminant or very severe very quickly. And you can have chronic infection where you're shedding that delta agent and potentially passing it on to other individuals.